Good afternoon, everyone. Gareth Presh, CEO, Global Social Prescribing Alliance. You're very welcome to our fourth panelist discussion, Technology's Role in Social Prescribing, How Digital Tools and Innovation Enhance Delivery and Scale. And I've got quite a panel with me today. I'm super excited for this session. In the last session, we were actually emphasizing the importance of digital technology and its adoption across social prescribing. It's a new area, it's a new field. It brings across enormous opportunity for industry. It's a $12 trillion market space by 2030. And we're going to hear from a number of experts who are in this space and are looking to develop this space, particularly in regions of lower middle income countries and, of course, in high wealth areas such as the Nordics. So let me just bring in our panelists and start with a round of introductions. Pascal, we'll start with yourself. You're very welcome, and I think you're probably calling in from Spain, I think.
I am calling in from Spain, although I am French. I live in Minorca, and I'm the head of Edito Health. Edito Health is a boutique consulting company that has been working on promoting digital health and more precisely promoting the adoption of digital health for about 20 years now. I started my career with Health 2.0. Some of you may remember that name. It was quite a buzzword at the time. And I acted as their global executive director for a few years, and then they were bought by HIMSS, and I became HIMSS head of content for international. My implication with this type of initiative is through EU-funded project. I've been part of quite a few focusing on digital health. I also organize events and conferences. I know Gareth because we have a close relationship through the Radical Health Festival, which he was referring to this morning, and everyone is welcome, of course. I do have a strong interest in social prescribing because it aligns really with the our conviction at Edito Health that we need to move from health systems to precision health systems. And this is not going to happen unless we do a few things. There are some data out there that say that recognize that only 25% of our health and wellness is about biology. There's a strong data supporting the fact that we need to take a holistic approach and stop confining the discussion about health to the medical setting and bring it more to the community. Clearly, this is very important for what we call precision health and what we see as the future of health. So I'm very grateful for Gareth to have me among yourselves today. Thank you.
No, it's a pleasure, and super excited that we're working together. We're the Radical Health Festival. I was grateful that you gave me the opportunity to speak last year. It was a brilliant conference. I'm so excited to be involved this year. And as I said, anyone who's watching this who wants to join us in Helsinki, we're taking a business delegation from the UK to Helsinki next year. So there's further details to come. Gabrielle, over to yourself. Pascal mentioned the precision medicine. We need quantum computing. The floor is yours.
Thank you so much for inviting Quantinuum. It is a pleasure to be here. I'm Gabriela Kimpan. I have a scientific background. It is in chemistry, but I've been working closely with the life sciences industry, the healthcare and the pharmaceutical industry for the past 30 years, most of the time from the software application and from the digital perspective. I've been part of the business development team at Quantinuum since 2021. For everyone, Quantinuum is a quantum computing company building the most advanced quantum computers in the world. We're also building the middleware necessary for these quantum computers and, of course, software algorithms suitable for these new quantum computers. In my current role, I worked on projects facing computational challenges using classical computing and assessing if a quantum computing approach could overcome them. We're also looking when quantum computers will be powerful enough and map this, the hardware roadmap with the use cases roadmap. And we estimate the quantum computers will be powerful enough in the near future. So it's not long term.
And I think there's a substantial industry opportunity here for quantum computing, particularly within pharmaceuticals, and being able to align to social prescribing is going to be an enormous opportunity. There are a number of initiatives that I'm aware of that are currently mobilizing significant sums of capital to support this growth. So let me just bring in Ben, because Ben is one of the pioneers who has been doing this sort of digital technology and engagement activism at the coalface. Is like blending communities and, shall we say, the physicians, the clinicians, the consultants. Ben from Good Boost.
Thanks, Gareth. It's great to be invited for this panel. So yeah, I'm Ben. I'm the CEO of Good Boost. My background is in musculoskeletal research. I'm an MSK clinical champion for Versus Arthritis, the largest MSK charity in the UK. I'm also a senior research fellow at the University of Exeter. Last decade has been looking at how do existing community spaces deliver health and wellbeing outcomes, and how can technology bridge that gap where there aren't sufficient skills or clinicians to deliver those services in community settings. So been working with community halls, leisure centres, gyms, swimming pools, so they can deliver health and wellbeing activities and services. And we've actually just published a really large research study on this programme, delivered in about 140 locations across the UK, showing the health outcomes were equivalent to seeing a face-to-face clinician. So it can be done, and it's really important where technology can bridge that gap, but to still leverage the human aspects in communities, those members of staff, those volunteers, and how can they create human connections and that motivation for people to engage and keep attending.
Brilliant, Ben. And of course, we need to have that backed up by academia. And Reinhard is the perfect individual to talk about that. Reinhard, the floor is yours.
Thank you for inviting me and organizing this great event, Gareth. So for my person is I'm a board member of an Austrian association called Prevenire, which is committed to push forward the development of the healthcare system. My disciplinary backgrounds are pure mathematics, computer science, some law, and social sciences, the latter including economics, but also qualitative empirical research. Right now, I'm doing transdisciplinary research on digital transformation across many sectors, but the major focus right now is on digital transformation of the healthcare sector.
And myself and Reinhard have been working together for a couple of years. We're starting to get to the point where the rubber hits the ground, and looking at projects across Switzerland, Austria, and other regions. Super excited to be able to start to crystallize some of that work. Let me bring in the clinical side now. Sruthi, it's over to you.
Thanks for inviting me to the panel, Gareth. Hi, I'm Dr. Sruthi Krishnamurthy, a clinician by training, currently working at the intersection of digital health, policy, and innovation. I've worked across frontline NHS care, and I'm currently completing my master's in health policy at LSE and LSHTM. And my research focuses on the use of AI and ML tools in virtual wards. And I'm particularly interested in leveraging digital tools to support prevention, improve patient journeys, and reduce the overall system burden. So yeah, that's me.
And not to forget that you're also a member of our executive team for West London.
Yes.
So let me come to Ben. Ben, you're in the coalface of designing this technology. How can technology be designed to enhance, not replace, the human element of social prescribing? Because you just mentioned your report. So, I mean, that's a great insight into that, isn't it?
Yeah, the great technology becomes tools for clinicians and members of the community to use rather than a direct replacement for any clinician or clinical service. As I mentioned, over the past decade, what we've seen is by putting digital health technology into community spaces, we can create clinical services that can be facilitated and delivered by members of community venue staff. Now, whether they are volunteers, whether they are lifeguards, whether they are fitness instructors, whether they are managers of the centre or service, technology bridges that skills gap and enables them to deliver that clinical health and wellbeing service. What we hear a lot in feedback is that from the participants and the venues that we deliver is the human connection that's created. They don't talk about the technology a huge amount. It's the members of staff and volunteers facilitating these programs with technology that remember the stories, the names, the motivations of the people that attend and come to them. They create this trust where some people may not be explicitly trusting of digital health or digital technology to manage a health condition. So where they can form those human connections and build that trust, that's what gets people coming through the doors and people coming back week after week. The other benefit is that when you can deliver in the community, when there are groups taking part in the program, is the opportunity to meet peers also living with a health condition, and that ability to create peer support that includes all the social and emotional support, which is essential for the motivation to initially engage and keep engaging. And for many of the participants we see, it can be their social highlight of the week. We see a lot of participants experiencing a lot of loneliness as well. And so when you can create that social event alongside a health and wellbeing activity, it's a great combination. What's important then is when you can work with peer groups, is we see this change in around accountability. People don't just feel accountable for their own health and wellbeing, they feel accountable to a group. And so when group programs can be delivered, you create these social contracts and people show up for others rather than just themselves. So what technology does is it bridges that gap to enable these community spaces that are not clinical venues, but community venues, but delivering health and wellbeing services, but can really lever on their position in the community, both in their geography, their recognition, the trust they have, to create rapidly scalable services in a way that traditional healthcare just couldn't.
Yeah, and it's so true. It's like on a Saturday morning, if I get a text off my mate and he says, do you want to go for a run? You feel guilty and you say, oh, well, I better get going, because it's that peer support, it's that peer pressure that kind of makes you go out the door. Reinhard, there's a serious question that many of us have, which is all about privacy, consent and ethics when we use AI and data analytics. And how does that apply to social prescribing?
In general, if you are discussing these three topics around privacy, ethics, non-discrimination, I would add as well, and on the other hand, consent, then you have to, I think you really have to separate these two issues. Consent is a question of of political decision making, rather with respect to what we want. Do we want an opt-in or an opt-out solution? I personally recommend opt-out solutions, which are possible all the time. So if you want to opt out, then you can do it, but you don't have to opt in from the start. Usually this is for social prescribing not such a big topic, because every time people are really concerned about their health, then they are usually willing to share data, as long as they really believe that it's about care for them. For the other issues, I think there are, I would say, 3 important strategies to guarantee ethical design. And the first is you start with a situated design approach. That is, you start with really understanding the situation and its context, and analyzing all kinds of ethical aspects in a multidisciplinary team. Personally, I like to involve artists into these teams because they add further perspective. And then really observe people, what they are doing so far in the situation, look at log data as long as it's compliable with privacy, do a lot of interviews and analyze the situation. And then make a design, which on the second level is really based on the best standards in technology and engineering. And this means that we do a humans-centered design. Maybe this doesn't work that well in English. In German, there's a difference between the single and the various humans. In our design approach, we always try to really focus on all humans involved in the game. And we focus on this perspective of digital enabling on a professional setting. That is, the design is done in a way that, as it was mentioned before, that the humans are really enabled to do a better job, in particular the healthcare humans, but also the concerned patients. And the third issue then is really an extended introduction process. So really to bring technology into working processes is right now the key challenge. This is particularly a key challenge if we want to exploit artificial intelligence. And this holds, of course, in particular for artificial intelligence in personalized medicine, but it also holds for social prescribing. To be very clear, I mean, what technology can help us in social prescribing is it can really give us a lot of insights into the cause-impact relationships. It can really explain to us when we analyze the data afterwards what has worked and what didn't work. And the second issue is, of course, it tremendously helps to add personalization to all kinds of social prescribing practices, always based on the fact that we have humans in the games that are enabled to do a better job in the sense of social prescribing. Now, concerning the engineering aspect with respect to ethics and privacy, I think I've never experienced that there was a problem with privacy as long as people did serious and proper engineering. And this means, in particular, with respect to data, you're only using those data that are needed. You're using them in an appropriate quality. This is always forgotten. People say, okay, we are not allowed to use too much data, but in fact, GDPR forces us to use exactly the data in the quality that is needed for a purpose, and to forget about all other types of data, not to prepare for optional causes. And then says, because we have a colleague from quantum computing here in the panel, I mean, there are lots of aspects in the engineering itself, as you obviously understand quantum computing is a great chance, but it's also a great threat to confidentiality in the game. And so if you have a good architecture in the design of the digital solutions, then it is easy to replace old encryption algorithms by new ones, which are quantum safe. But right now, I've seen in many sectors that people have no clue where they are using any kind of encryption algorithm. So which is a threat itself to confidentiality. So to sum up, I would say C280 design, state-of-the-art engineering, which really doesn't try to save money on compromises. And third, a very careful introduction process, which respects the fact that reality decides on the impact and not what we as engineers are thinking about it.
Oh, brilliant. Thanks for that, Reinhard, because I think I'll be interested to hear Gabrielle after Pascal, just to see how the infrastructure stacks up, because we'll put those questions to Gabrielle. I'm sure she's got a response. But let me go to Pascal, because he's heavily involved in sort of the innovation space, working with the startups, particularly within the Radical Health Festival, the Nordic ecosystem, which is very rich. Pascal, like, what innovations are helping to match people with the most relevant community resources? I mean, I know Ben has just given a great example through Good Boost, but what are you seeing?
Well, I would say there are two main categories. There are professional facing solutions, and then there's consumer solutions also that we need to take into account. They're quite different. But if we look at professional solutions, I was reading this morning that there's 4,000 plus GPs in the UK that have access to a social prescribing platform if they want to use it. That's pretty big. And I'm sure that we're going to go increasingly in that direction. With consumer solutions, we have also a lot of things that can be done. And we have to remember that our phones are geolocalized. So if we want to find a community to connect to for a certain reason, we can. There's also ubiquitous technologies that are coming more and more prevalent. I mean, we know that our health is around our wrist right now, but it will be embedded in our walls. And to follow up with a question that I thought you raised with Reinhard, the data is getting more and more intimate. So at what point, gathering data is one thing, but at what point do we allow anyone, whether it's a private solution or a public entity using a certain technology, at one point do we want to share this kind of data? I mean, I'll give you a very basic example, but nowadays with your phone, you can know if someone has not moved from their couch in the last 3 weeks. Now, what do you do with this information? Who has the right to do anything with this information, and what should you do? Yeah. Do you want to send an alert to the person? Do you want to send an alert to someone in the community of care of that person? I mean, the privacy concerns, I understand the previous speaker's point, but they're getting more and more complex as we're getting more and more intimate into our lives. Mm-hmm. There are some things that we could highlight in terms of consumer technologies. Digital therapeutics are making great advances, at least in Europe, because of some program that allows them to be used and reimbursed, which we know is a big point. In the US, people are ready to be consumers of health. In Europe, we think that if it's about diabetes or about a heart condition, it should be taken care of by the health system. So reimbursement was a huge progress. There's also a lot of coaching solutions that are appearing on the market, and these are interesting because they mix the technology quite often. They mix the technology with a human interaction, which I think, I have been focusing on technology for like the last 25 years, but I'm not a technology for the sake of technology. And frankly, if we can detect cancer with dogs sniffing patients, I think we should train dogs and not algorithms. So I'm not, a pro technology at all cost, but there are some things that can help us do our job better, helping people being as healthy as they can for as long as they can. I'm not sure if that answers your question, Gareth. I may have diverged a little.
No, it does, and I agree. It's a blended approach, and the tools, that's technology is a tool. It's got to be used. It's like for many people, I've been involved in implementation of health systems, for example, and technologists need to understand that doctors, they're not technologists. They went to college for a reason, and that was to treat patients. Okay, so that's their job. That's why they spend 12, 13, 14 years studying. But what the technologist needs to understand is give them time to treat. That's what they want, is that time to treat. I see it over and over and over again when you're trying to implement technology. You don't make the business case around giving the clinician more time to see the patient. That's what it's about.
And how many times, Gareth, have you been fighting with an automated system where you're yelling at the system, give me a representative, because the system is not, fine-tuned enough to really understand the details and the fine lines behind what you're asking and what you need. And I think this is something that we need to be very careful with in social prescribing, because we're touching at something that's very intimate with people.
And that's so there's a couple of points, because I'm great. We're going to go into Gabrielle now, and Gabrielle, and this is the beauty of what we're talking about. Can be designed at the start, at the outset, because social prescribing is emerging. So you can get that infrastructure right. We can actually bring that expertise with the likes of Quantum and others to make sure we have that infrastructure correct. And the point I want to make before I go to Gabrielle is there are technologies. When you talk about the privacy and that, don't forget there's quite a lot of fridges out there that have cameras on them. Okay, and that technology can be used to detect mental health issues, for example, depression. So there are tools that can be enabled, and I think we're going to see a massive shift with, personalized care. Healthcare will be brought closer to your home. The future of healthcare will be in your house. You will be able to access those services. So Gabrielle, there's not really a big question for you, but just how do we build the infrastructure?
Yes. So before I go into that, maybe I can address one of the questions and the comments from Reinhard. He mentioned cybersecurity and the threats that quantum computers may pose to cybersecurity, breaking encrypted data. Quantinuum also offers cryptographic keys that are generated from something we call certified randomness, and is NIST approved. So it's approved by the Institute of Standards in US. Is not something that will be available in the future. Is something that is available today and can be used as a cryptographic key in existing cybersecurity systems. There are lots of details on our website for anyone who's interested, but I just wanted to add a comment to that.
Brilliant.
So quantum computers can be a threat, but also the cure. Coming back to health, there is a definition for health, and I looked it up. It's a definition on the World Health Organization, and it says that it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And then it goes on saying this definition means that health is more than just the absence of illness. It includes a positive state of being across multiple dimensions. And that's very, very comprehensive, because we are unique individuals, but we also share a large part of our core structure. So we have some common bits and we have some unique bits. And across various sciences, we know a wealth of information. We know quite a lot, we can say, but there is also much that we don't know. And from that point of view, we would like to understand what common causes make disease develop, for example, what from our unique makeup contributes, what from our external environment perhaps contributes, and what can help prevent and heal with or without external helping agents. And I'm thinking of medicine here, for example. And this is a hugely difficult problem to solve. It is mathematically difficult because there are so many parameters to take into consideration, a huge number actually, which most of the time we can quantify and analyze individually. But when there are interconnecting and there are interdependencies and influenced by external factors as well, like genetics, environment, choices we make, this is a very complex mathematical equation to put into a piece of software. And thinking from the social prescribing perspective, it also has to take into account many interconnecting parameters, perhaps too many parameters and too many interdependencies to analyze this comfortably with classical computing. AI was mentioned earlier. AI, artificial intelligence, is certainly having a moment today. There are many applications across industries and across environments, lots of research happening today. Quantum computing can help enhance AI and can help enhance this beyond the current limitations of classical computing. They work hand in hand. AI is very good when it needs to improve speed, accuracy, the ability to learn from large amounts of data, for example. And certainly today we have the capability to collect and generate vast amounts of data. But understanding it holds the key to solve some of this unknown and maybe look for new paths for research. A quantum computer works fundamentally different from a classical computer. It's not just the speed, but it's also the way how it processes and stores information. And to go a little bit technical, a bit in classical computing can have a value of 0 and 1, and we've all seen these strings of binary zeros and 1. A qubit, a quantum bit, can have a value of 0, 1, or a superposition of both. This is difficult to understand for a human brain, but this superposition is a mix of 0 and 1 at the same time, allowing for the simultaneous evaluation of many possibilities. And of course, this is an oversimplification of how a quantum computer works, but this is where the quantum computing power lies, in handling this complexity. It also means that not every problem will be suitable for a quantum computing approach. So understanding what is suitable, where we don't have to reinvent the wheel, where quantum computing can be of help when they will be fault tolerant, because at the moment they're quite error prone, this will be the key.
Brilliant. I think you've given such a great oversight there and explanation around quantum computing. I'm sure there'll be quite a number of people watching this on record. Let me go to Dr. Sruthi in London. It's great having these digital technologies come to the forefront, but how do we ensure, that the technology doesn't exacerbate health inequalities? There's a lot of people, the digital divide. There's so many people who don't have access to these technologies.
Yeah, that's a very good question, actually. So digital health tools do come with a lot of promise, I think, but there are also a couple of blind spots. I think it's not about just building smart tools. It's about building systems that actually serve people, especially the ones that we tend to overlook. And if digital health tools can't reach those who are in need most, it's not really a health innovation. It's only exacerbating the health inequalities. So I think we need to design for inclusion and not assumption. Too many digital tools assume there would be a stable Wi-Fi, fluency in English, and tech confidence and literacy. But what about older adults, neurodivergent people, migrants, carers juggling different jobs? And there are frameworks that make it clear, such as a digital inclusion framework by NHS. And that means we need to co-design from the margins and not just optimize for the center. Digital tools should support care and not substitute it. I think tech would be great at enabling nudges, referrals, access, but like everyone discussed, care is built on relationships and trust, and especially in social prescribing, where I think the magic happens through human connection. Digital tools should act as a bridge and not a replacement, as Ben mentioned as well. And it's not about scaling content; it's about preserving the contact within a community as well. And as you mentioned a while back, Garrett, digital tools should be built to free up clinicians to do what matters. Clinician time, if designed well, I think they can give clinicians back the time and the headspace to actually give the care the patients deserve. And too often, I think we are creating platforms that create more work and not less. So we need to build with the end users and make them as co-creators. And I think most often we measure uptake and scale, but we, I think, need to ask, did this tool reduce stress? Did this tool reduce the isolation? Did it lead to an earlier intervention? And I think there are frameworks such as What Good Looks Like already exist, but we need to embed them meaningfully. So because prevention does matter, and we have to start measuring it like it does, create a different metric for it. And I think lastly, it's about connecting the systems. Right now, there's a lot of data fragmentation, which we are working towards with FHIR. And I think that is one of the biggest barriers to equitable care. A GP might refer a patient to for social prescribing, but then what? How would the patient track it? There's no shared view. So we need an interoperable system that allows safe, seamless connection, and keeps the patient also part of their care journey, and not in silos.
Brilliant. I think just one thing to pick up on there when you're talking about the measurement and that, let's not reinvent the wheel. We have the UK's Green Book, and I'd also think we don't have to go for sort of numbers. If we put £1 in, what did we get? Did we get 10? Did we get 15? Last session we were talking about 17 for the football cooperative, for example. But look, if we put £1 in and we get 2 back, let's just do it, because that's a benefit. You know what I mean? We're showing that it saves money. Let me just do a quick round of questions now, because we've got about 13 minutes left. So we've got quite a bit to go through. So let me put a couple of questions to you. So Ben first, what does the future of technology and social prescribing look like to you? Because you're at the coalface to this.
I think the future of technology is interesting. I think the reality is bad implementation eats great technology for breakfast. So it doesn't matter how good the technology if it's not implemented well. Do you know what? I think a lot of the technological solutions probably exist out there somewhere, that that's not integrated well. Handing someone an app on their phone and saying that's going to make you better just doesn't work. There are over 300,000 health and wellbeing apps out there. It hasn't been the panacea. It's not the silver bullet. I think it's not necessarily about the future of technology, but it's how do we better integrate it into our communities? How do we ensure that it can deliver services? But how do we really understand what's the motivation for anyone to engage with a digital service through social prescribing or another community group or activity? The most downloaded and used technology on the planet is social media. The reason for that is that people don't form relationships or bonds with their phone. The reason social media is so popular, it's the world of human connections through that window on your phone, where we can understand that behavior to get repeat engagement with a health service or activity delivered in community settings facilitated by digital technology. It's about human relations and connections that mean that people show up day after day. Because when the biggest burden we're looking at into the 21st century is non-communicable diseases, these are things that require lifestyle change, regular repeated habits. How do you create that behavior change? It's mostly going to be through human connections so that people show up and then access a digital service that benefits health and well-being. We need to focus on the implementation, not just the technology in isolation.
Brilliant, Ben. And just from I think you hit the nail on the head there. But Pascal, from your perspective, so what does the future of technology and social prescribing look like for you? I mean, I know we're going to have a panel discussion on this in Helsinki. We're working on it at the moment. We're curating it. So this is exciting.
We will, for sure. Well, I agree that technology can support, but is not about to replace the human touch, especially in the area where health and social care intersect, and even more sources of data, again, more intimate. I think that technology can bridge, can nudge, can trigger, but also we have to recognize that behavior change will stay with us. I mean, my phone is not going to make me go to the park or to interact with socially with people around me. It's a tool. It's a tool for professional. It's a tool for consumers and citizens. I'm not saying patients, because we're talking also a lot about prevention, but I can have as many nudges as you want. If I don't have the behavior change will within me, the nudges won't do anything. It's like an alarm clock that you snooze all the time. I'm also wondering about the funding of this kind of technologies. Because, for the last, I think, 20 years, VCs have been looking for unicorns. And is there a social impact unicorn? Maybe not. So when it comes to funding something that is for the good of the population, but may not have a return within the 5 years, which is standard with VCs, then what are the available sources of funding for it? And then I think the last point, which is the subject of the next panel, if I'm correct, is the fact that if it doesn't integrate one way or another with what we call healthcare or health and care, the general system, it will always stay something that is apart, something that you can ignore. And this is something that we've seen with DIGA companies. You can prescribe apps and drugs at the same time. People will go right away to fill their prescription. They will take months to start their digital therapeutic onboarding. And there's a very high number of people who will never start it. So there's prescription and prescription. And I think there is a mentality change that needs to happen also in citizens' minds, that it might be digital, it might be social, but it's a prescription. It's something for you.
Exactly. So I think great insights. We've got about 7 minutes left, so we'll run down through the questions. But I just wanted to say to you, on the unicorn side and the social value side, I personally believe that the future of business is aligned to social value, and I believe businesses that adopt that model will benefit enormously. I think you'll find over the next 4 to 5, probably next 12 months, you're going to see this as an emerging market, particularly as funds flow into those new industries, shall we say, and new companies that adopt that format. Gabrielle, quickly, 30 seconds. What does the future of technology and social prescribing look like?
So yes, quantum computing, quantum physics, this is very complex science, and I see it as the engine behind the transformation. So if you have a smartphone, you don't need to understand how that works, but the large majority of people are using one, and they're being very successful in doing so. So yes, bringing this deep tech information to other disciplines so they can take advantage, looking at use cases, this is where I think quantum computing can be of help.
Brilliant. And in 30 seconds, Reinhard, over to you. Can you match that 30 seconds? What does the future of technology and social prescribing look for you?
Okay, I still start with a small provocation. Integrating users into the design is a must-have, but it's not good enough. To be very clear on that, we have to advance further. No, I think the future of technology in social prescribing will be technologies that is the result of a transdisciplinary design process where also the understanding of all perspectives are brought together. This will be a game changer, and as a result, we'll also have much more scientific data on the real impact of social prescribing.
Brilliant. Over to you, Sruthi. If you can, in 30 seconds, tell us what the future of technology and social prescribing looks like to you.
Yeah, I think for me, it's about keeping people at the part of their care journey, empowering them to become CEOs of their own health, strengthening the community care, primary care, so we free up clinician time, secondary care, and A&E time to actually do the work that they're meant to do. And we don't just see better patient experiences, we see fewer avoidable A&E visits, less burden, millions saved for the NHS. And I think Viz London 2026 festival is about that next step, bringing together upstream, local, human-centered solutions and, turning prevention into practice. So that's the future I see.
Okay, brilliant. So we have like just a couple of minutes left. So what I would really like to do is to give everyone the opportunity just to have some final thoughts, like in the last couple of minutes. Just if we could keep it for, similar to what, 30 to 45 seconds. But let me start with Pascal first. Pascal, your final thoughts.
Well, maybe it's a conclusion of someone who's been following the adoption of digital health technologies, whether it's for social needs or healthcare needs, which quite often cross. I think the conclusion after these years is that nothing happened without strong policy. We're seeing it with the question of interoperability. It's a question I've been doing conferences for as long as I can remember, and interoperability was always on the agenda. Why? Yes. It was never a technical, well, it was a technical question at some point, but it stopped being a technical question years ago. Yeah. And now we have EHDS in Europe, and things are going to move. But I think my conclusion is that we may have the technology, we may have some good willing people, but if there's no policy in place to make sure that it's ingrained in the way that we do things from now on, then things take a lot longer. Yeah. That would be my conclusion.
Okay, no, I appreciate that. Ben, quickly from your perspective, final thoughts.
Just looking at some UK stats, there are about 7,000 gyms and leisure centres, about 4,000 pools, about 20-odd thousand community spaces. Now, they are in communities, they are these existing assets. How do we utilise them to put services there? How can technology bridge that gap? Because these are trusted venues, known venues, using existing transport links with great social support around them too. It's my view is we need to figure out how we better utilise existing spaces through technology, and if we can implement it extremely well and integrate that so people have a tangible service rather than just being told there's an app for that, I believe we'll get greater engagement for people to access self-management.
Brilliant, Ben. Gabrielle, over to you. Final thoughts, 30 seconds.
Yes, so it's bringing this complex information to other disciplines and also to society so they understand what is happening. And I'm very glad to see this initiative in social prescribing getting a lot of tractions now, because I think it's going to have a huge impact on everything you would like to do and prevention in the end. But yes, complex science needs to be made accessible to everyone.
Oh, I love that. I love that. Absolutely. Reinhard, final words, 30 seconds.
I think we have to create more support for social prescribing among general practitioners. I mean, I know a lot of them who are very committed to it, but still we need more commitment from their side. So I strongly recommend that also with respect to technology, that we start with focused lighthouse projects which are really successful and therefore create curiosity among all others observing why these things work so well when we really use in a technology in an advanced and careful way. So I think we have to create more curiosity in the success that's possible with social prescribing.
Thanks a million. And final words, Sruthi?
Yes, I think it's about designing with intent, co-creating with communities, educating people about social prescribing first, and then also to take responsibility of their own health. System focused on illness being treated to one that actively is building wellness. And I think social prescribing is a key part of that shift. And it'll reconnect people to their purpose, support, and belonging beyond just the clinic or the hospital setting. And I think Wiz is doing a great job with it.
Thanks very much. Listen, what a fabulous panel. We've just about finished on time. I think Reinhard's point, how do we get the clinical integration? That's the next session. So make sure you join us. Also, there is tools available. If you want to look at best practice, we have them on the website. You can download them. They're free. We have a social prescribing playbook. So we do have those best practice case studies. We've worked over the last 5 years to pull this together. So do look at that resource. So for myself and the panel here, I just want to say thanks for joining. Grateful to the panelists, and we'll talk in about 10 minutes. So thanks, everyone.